These are protesters in front of Senate Majority Leader Mitch McConnell's office, many of whom are in wheelchairs.
They're protesting the Medicaid cuts in the Republican health care bill.
President Trump and Republicans in Congress are proposing huge cuts to Medicaid.
The 50-year-old federal safety net, which right now covers about 1 in 5 Americans. People with disabilities may be the first to feel these cuts.
My attendants help me do everything. Getting out of bed and toileting and getting ready for the day. And that's all funded through Medicaid. Hi, Corwin. This is Stacy with Accommodations. I'm able to work right now 40 hours a week, but that's possible because I have attendant support.
Medicaid's budget has been growing in recent years, and it now makes up almost 10% of federal spending.
The largest savings in the Senate's health care proposal would come from reductions in Medicaid spending.
Many Republicans say slowing the growth of Medicaid is crucial to saving it.
Medicaid is a welfare program. It's primarily designed for the indigent elderly, the disabled, the blind, and children.
Obamacare expanded the pool of Medicaid recipients beyond its original intentions.
We have a provision that very slightly slows down the rate at which Medicaid will continue to grow, so that this is actually a sustainable program. I think it's very reasonable.
Entitlement reform has been the holy grail for Republicans for a generation.
So Medicaid, sending it back to the states, capping its growth rate. We've been dreaming of this since I've been around, since you and I were drinking at a keg, you know.
I was thinking about something else. He was thinking about reforming Medicaid.
I was.
Make no mistake, this is a repeal and a replace of Obamacare. Make no mistake about it. Make no mistake.
It's important to realize that this isn't just a rollback of Obamacare. It's actually a deep cut of traditional Medicaid programs that cover disabled people and kids. It caps spending over time and reduces it by up to 35% over the next 2 decades. So you're talking billions of dollars here. And with that kind of cut, states really only have a couple of options. They can either raise taxes, they can cut eligibility, or they can cut the services they offer under Medicaid. And one of the services they offer is home services for disabled people.
When I think about being like 18 or 19 years old, it was really challenging because that's when I started to identify as queer or gay, and my parents are evangelical Christian, and so it was really hard to have space to sort out what that means when my family is the one that's providing my day-to-day care. Moving away to me symbolized I'm worth it. I mean, living on my own, which is possible because of attendance supports, means I can live the life I want, and that was a big turning point to me. If I was living with my family because of care needs, then my life would look very different.
My workers are paid $12.50 an hour through the Medicaid program. They bathe me, feed me, get me up into my wheelchair. They drive me to work, set me up. As my needs have become more significant, I need to have people around a lot more often. If I drop the respirator tube, is there going to be someone there to pick it back up, and how long will I be okay without the respirator tube? It's very easy to draw a red line across a piece of paper as a budget item, but they don't know what it really means out in the world. People don't see us as real people. We're just line items. Have a good day. Okay.
Advocates say these services are at risk under Trump's proposed budget because they're considered optional. Medicaid is required to pay for hospital and nursing home care, but not in-home therapy and support.
Those services under the Medicaid program are optional, they're not required. So when states are squeezed for money, They're going to reduce those services or end them altogether, and without that help, they face institutionalization.
I went into the nursing home at age 15. At that point, I was a sophomore in high school, and frankly, when you're in a place with a lot of people yelling and puddles of urine on the floor, it was so clear that everybody was waiting for me to die. There were no plans for my future.
In the 70s and 80s, Medicaid began to be used to provide services in the community rather than institutions so that people could have control over their lives. The fear now is that this is a tremendous loss of hard-won gains by the disability rights movement over the last 4 decades.
On April 5th, 1977, 500 to 600 people in wheelchairs with walking canes and hearing aids stormed the regional office of Health, Education, and Welfare in San Francisco.
I lived in this building, ate, slept in this building for 2 weeks, fighting for the rights for disabled persons to have an independent life.
Their purpose? To stop discrimination against the disabled in what will become the longest occupation of a federal building in U.S. history.
For many disabled people, it was the first time that we really had come together, felt our power, recognized that we had a right to equality.
2 weeks pass, the deadlock continues. The Black Panthers send in cold sandwiches. Others bring in mattresses and a portable shower.
Special congressional hearing convened.
We will no longer allow the government to oppress disabled individuals. We want the law enforced. We want no more segregation. We will accept no more discussion of segregation. And I would appreciate it if you would stop shaking your head in agreement when I don't think you understand what we are talking about.
His shaking his head in agreement, I really felt symbolized a lot of people shaking their head, saying, I understand, when they didn't.
Tonight, 35 million Americans are no longer second-class citizens. What is being called a Bill of Rights for all of this country's handicapped has finally been signed by HEW Secretary Joseph Califano.
This particular point in time demonstrated that we should not be looked at as object of charity and cure. We wanted the rights like everyone else, and still do. We are a part of the whole, and we don't want to be excluded anymore. And healthcare is pivotal to that.
No cuts! No cuts! No cuts! No cuts! No cuts! No cuts!
The America that I love, the America that I defended, we don't leave people behind. We don't say that you don't get a chance to your American dream just because you're different. No cuts, no caps to Medicaid. Thank you.
I was flying a mission just north of Baghdad when my Black Hawk was hit by a rocket-propelled grenade, which essentially exploded in my lap. It vaporized my right leg on impact, amputated my left, and took off the back of my right arm. And I spent the next 13 months at a hospital learning to live my life all over again. I think I definitely have a significant insight that, and I can probably safely say that none of my colleagues in the Senate have. Those home healthcare workers are everything for someone who may need a little help getting dressed, who may need help with medication, getting out the door, so that they can live those full, productive lives.
About 50 of us got arrested today. We've been here waiting for them to come out.
I was in the wheelchair, breaking the chains.
Medicaid paid for my shower today, made it so I was able to eat breakfast, helped me put on my clothes. How's it going? I breathe because of Medicaid, my ventilator. I move through the world because of a wheelchair funded by Medicaid. Medicaid touches everything in my life and makes everything possible, and it's not just healthcare, but it's really about my ability to participate in society is because of Medicaid programs.